High blood sugar rarely starts with pain. It usually starts with quiet signs you may blame on age, stress, or a bad night of sleep. And if you ignore those signs long enough, the damage can spread to your eyes, nerves, and blood vessels before you even know what's happening. If you want to stay healthy and independent as you age, hit that subscribe button right now. We share simple, science-backed health tips like this every single day, and the next one could help you catch a problem early. Here's the thing. High blood sugar, also called hyperglycemia, does not always shout. A lot of times, it whispers. Your body gives clues, small ones, easy to miss ones. The trouble is, those clues often look normal at first. Over and over, the research shows the same pattern. People wait for a big warning, a collapse, a hospital trip, a scary diagnosis. But many blood sugar problems show up long before that, and the sooner you catch them, the better your chances of protecting your vision, your energy, your feet, and your long-term health. So in this video, I'm going to walk you through 7 silent signs of high blood sugar, not in a confusing medical way, but in plain English. And some of these signs come as a pair, which is why I'm counting them down in 5 big warning groups. Now, before we continue, tell me your age and where you're watching from in the comments. This helps us understand who we're helping. Here's what most people get wrong. They think high blood sugar always feels dramatic. They think you will know right away, but that is not how it often works, especially in the early stages. Not loud but quiet, not sudden but gradual. That's why so many people brush these signs off. Look at what the numbers show. A 2023 analysis from the University of Washington School of Medicine, working with the CDC and the University of Chicago, estimated that 9.6 million Americans had diabetic retinopathy, which is blood vessel damage in the eye, in 2021. That was about 30% higher than earlier estimates. Even more eye-opening, about 1 in 4 adults age 40 and older living with diabetes had it. Think about that. Many people did not feel very sick, yet damage was already happening. That is why this matters so much after 50 and even more after 60. Your body can compensate for a while. It can keep you moving, keep you cooking, keep you driving. But inside, extra sugar in the blood works like sticky syrup. It strains the kidneys, irritates the blood vessels, and makes it harder for nerves and tissues to do their job. So let's get into the countdown. Number 5, more bathroom trips and feeling thirsty all the time. Most people think this just means they drank too much water, had too much coffee, or have a small bladder. But actually, this can be one of the earliest warning pairs of high blood sugar. Why does it happen? Think of your kidneys like a coffee filter. Their job is to strain waste out of your blood. But when there is too much sugar in the bloodstream, that filter gets overloaded. Your body tries to flush the extra sugar out through urine. And when you pee more, you lose more fluid. Then your brain sends out the thirst signal, so you drink more. Then you pee more again. It becomes a loop. A 2022 systematic review in Frontiers in Public Health found that diabetes was linked to a 49% higher risk of nocturia, which means waking up at night to urinate. In men, the risk was even higher. So if you are getting up 2, 3, or 4 times a night and wondering why, don't just blame age. Let me be clear. One busy day in the bathroom does not mean diabetes. But if this has become your new normal, especially with dry mouth, tiredness, or more hunger, it deserves attention. So what should you do? First, notice the pattern. Are you thirsty even after drinking? Are you waking at night to pee more than usual? Are you passing large amounts, not just a few drops? Write it down for 3 days. Morning, afternoon, night. This kind of simple log helps you see what your body is trying to tell you. Second, stop making the common mistake of fighting thirst with sweet drinks. Juice, sweet tea, regular soda, and fancy coffee drinks can push blood sugar even higher. Water is your best first step. Start the day with 8 to 12 ounces of plain water. Keep a bottle nearby. Sip through the day instead of chugging all at once. Third, build meals that do not hit your blood sugar like a hammer. A simple breakfast could be 2 eggs, 1/2 cup of dry oats cooked into oatmeal, and 1/2 cup of berries. That gives you protein, fiber, and slower burning carbs. Not a donut, but a steadier start. Not a glass of juice, but whole fruit with fiber. If lunch is where you struggle, keep it easy. Try 3 to 4 ounces of chicken, 1/2 cup of brown rice, and 1 to 2 cups of non-starchy vegetables like green beans, broccoli, or salad. Why does that matter? Because fiber and protein slow the rise of blood sugar after you eat. And if thirst is extreme or you feel weak, dizzy, or confused, do not wait. Call your doctor. But wait until you see number 4. because this next sign often shows up when people think they only need new glasses. Number 4, blurry vision. Most people think blurry vision means they are just getting older. And yes, aging can change your eyesight, but actually, high blood sugar can make your vision go fuzzy even before permanent damage happens. Here's a simple way to picture it. The lens inside your eye works like the lens in a camera. It has to stay clear and keep the right shape to focus. When blood sugar runs high, fluid shifts inside the eye. The lens can swell, almost like a sponge taking on water. That changes how light bends, and suddenly words look soft, road signs look hazy, or your reading glasses seem off. Clemson University explains that high blood sugar can change fluid levels in the eye, causing temporary blurry vision. But here is the deeper issue. If blood sugar stays high for too long, it can damage the tiny blood vessels in the retina, which is the light-sensitive tissue at the back of the eye. That is when temporary blur can become something much more serious. Remember that 2023 University of Washington analysis I mentioned earlier? About 1 in 4 adults over 40 with diabetes had diabetic retinopathy. That means vision problems are not rare. They are common. So what should you do if this sounds familiar? First, do not rush out and change your glasses if your vision has suddenly shifted over days or weeks. If blood sugar is the real problem, the prescription may change again once sugar comes down. That means you spend money and still do not solve the cause. Second, pay attention to timing. Does your vision get blurrier after a heavy meal, after dessert, late in the day when you have had very little water? Those details matter. Third, protect your eyes with a steady daily routine. Build meals around the plate method. Fill half your plate with vegetables. Use 1/4 for protein, like 3 ounces of salmon, turkey, tofu, or chicken. Use 1/4 for a slower carb, like 1/2 cup of beans, quinoa, or sweet potato. Add 1 cup of leafy greens several times a week. These habits help your whole blood sugar pattern, not just one reading. And please schedule a dilated eye exam if your vision has changed and you have diabetes, prediabetes, or risk factors like belly weight, high blood pressure, or family history. Do you really want to gamble with your eyesight when a simple exam can catch trouble early? Quick question. Have you ever had blurry vision, especially after eating or late at night? Comment yes or no below. Now let's move to number 3, because this one often starts in the feet and gets brushed off as poor circulation. Number 3, tingling, burning, or numbness in your feet or hands. Most people think this is just part of getting older. Or they say, I slept wrong, or my shoes are too tight. But actually, this can be a sign of neuropathy, which means nerve damage. Why would high blood sugar affect your nerves? Think about electrical wires in your house. They need protection and a clean flow of power. Your nerves are a lot like that. When sugar stays high, it can damage the small blood vessels that feed the nerves. Over time, the nerve signals start to glitch. That is when you may feel tingling, burning, pins and needles, numb spots, or a strange feeling like you are wearing invisible socks. A 2024 study involving researchers from King Saud University, Imam Abdul Rahman bin Faisal University, and CMH Lahore Medical College found that peripheral neuropathy, meaning nerve damage in the limbs, showed up in 44.4% of people by questionnaire and 51.1% by foot exam. That is huge, and it tells you something important. Many people have more nerve trouble than they realize. Here's the danger. When your feet get numb, you may not feel a blister, a pebble in your shoe, or a small cut. And that tiny injury can turn into a major problem later. So this is not just about discomfort, it is about protection. Start tonight with a 1-minute foot check. Sit down in good light. Look at the tops, bottoms, heels, and between the toes. If you cannot see well, use a hand mirror. Are there cracks, redness, blisters, swelling, or color changes? If yes, do not ignore it. Wash your feet with lukewarm water, not hot water, because numb feet can burn without you realizing it. Dry gently, especially between the toes. Wear clean socks. And please, do not walk barefoot, even in the house. A sharp edge on the floor is all it takes. Food matters here too, not because one meal can fix a nerve, but because steady sugar helps prevent more damage. Build simple meals with protein and fiber. Try 3 ounces of fish, 1/2 cup of black beans, and 1 cup of roasted vegetables. Or 3/4 cup of plain Greek yogurt with a small apple and 1 tablespoon of nuts. These meals digest more slowly than cookies, crackers, or white bread alone. And if you notice numbness, burning pain, or loss of feeling, ask your doctor for a foot exam and a blood sugar check, not later, soon. Before we go further, if this is making sense so far, hit that like button. It tells me you want more videos like this. Now here comes number 2, and this one is more dangerous than people think because it hides in plain sight. Number 2, cuts that heal slowly and infections that keep coming back. Most people think my skin just heals slower now. And yes, healing can slow with age, but actually high blood sugar can slow healing much more than normal aging does. It can also make infections more likely, including skin infections, foot infections, yeast infections, and gum problems. Why? Because healing is like a repair crew showing up after a storm. Your body needs good blood flow, immune cells, oxygen, and building material like protein. But when sugar stays high, that repair crew gets delayed. Blood vessels do not deliver as well. Immune cells do not fight as sharply. And bacteria love sugary environments. Johns Hopkins reported in 2021 that among patients who had a minor diabetes-related amputation, 23.6% needed another amputation within a year. But they also found something hopeful. In a prior study of 621 diabetic foot wounds treated by a specialized team, 73% of wounds healed overall. That tells you 2 things. First, wounds are serious. Second, early care works. Northwestern University also noted in 2023 that about 15% to 25% of people with diabetes develop a diabetic foot ulcer at some point. That is one reason even a small sore should never be shrugged off. And don't forget the mouth. Mayo Clinic points out that diabetes can weaken your ability to fight germs, raising the risk of swollen gums, loose teeth, and gum infection. So if your gums bleed when you brush, that is not something to laugh off. So what should you do? Start with a daily skin scan, especially on the feet. Look for new cuts, cracked heels, redness, swelling, or warmth. Check any sore that is not clearly improving after a few days. If it looks worse, leaks fluid, smells bad, or feels hot, get medical care quickly. At home, keep wounds clean and covered, but do not use strong home remedies that irritate the skin. And never trim corns or calluses with sharp tools. That goes double if your feet are numb. Support healing with enough protein. A good target for many older adults is 20 to 30 grams of protein per meal, depending on health needs. That could look like 4 ounces of chicken, 3/4 cup of cottage cheese, or 1 cup of lentils with an egg on the side. Add vitamin C foods too, because they help tissue repair. A simple option is 1 orange, 1/2 cup of strawberries, or 1/2 cup of bell pepper. And please stay on top of dental care. Brush twice a day, floss gently. If your gums are red, puffy, or sore, book a dental visit. Your mouth can be one of the first places high blood sugar shows up. I'd love to hear your story. What made you click on this video today? Share in the comments. Because number 1 may be the most overlooked sign of all, and many people call it just getting older. Number 1, crushing fatigue and brain fog. Most people think tiredness means poor sleep, stress, or a busy week. Sometimes that is true, but actually high blood sugar can make you feel drained even when you are doing everything right. This confuses people because they think, if I have more sugar in my blood, shouldn't I have more energy? Sounds logical, right? But here's the catch. Sugar in the blood is not the same as sugar getting into the cells. Insulin is the hormone that helps move sugar into cells to be used for energy. When insulin is not working well, or there is not enough of it, that fuel stays stuck in the bloodstream instead of reaching the places that need it. It's like having a truck full of groceries parked outside your house while your kitchen is empty. The food is there, but you still can't make dinner. That can leave you tired, sluggish, and mentally fuzzy. You may feel heavy after meals, you may struggle to focus, you may want a nap after breakfast, you may even feel irritable and not know why. A 2024 study led by Washington State University and McLean Hospital followed 200 people and found that very high and very low glucose levels were linked to slower and less accurate cognitive processing speed. In simple words, when blood sugar swung too far, the brain did not work as sharply. Older adults were among those hit harder. So if you keep saying, I just don't feel like myself, listen to that. Your body may be asking for help. What can you do starting now? Keep your meals regular, not giant gaps, then a huge dinner. Not only toast for breakfast, then cookies later. Try eating every 4 to 5 hours while you are awake. Pair carbs with protein each time. For breakfast, 3/4 cup plain Greek yogurt with 1/2 cup berries and 2 tablespoons of nuts works well. For a snack, try 1 small apple with 1 tablespoon of peanut butter. For dinner, 3 ounces of turkey, 1/2 cup sweet potato, and 1 to 2 cups of vegetables can keep things steadier than a bowl of pasta by itself. And move after meals. You do not need a gym. A 10 to 20-minute walk after lunch or dinner can help your muscles use sugar better. Think of your muscles as a sponge. When they move, they soak up sugar from the blood more easily. Sleep matters too. So does stress. So does medication timing. But if the fatigue is new, strong, or constant, especially with thirst, blurry vision, more peeing, or numb feet, get checked. Let's pump the brakes for a second. I'm not saying this to scare you, but you should know when high blood sugar crosses from warning sign to medical issue. If you have vomiting, confusion, chest pain, trouble breathing, fruity smelling breath, sudden severe weakness, or you cannot keep fluids down, get medical help right away. If your blood sugar is over 240 milligrams per deciliter and you feel sick, call your doctor and follow your care plan, especially if you have type 1 diabetes. Also, be careful with sudden changes if you already take diabetes medicine. If you use insulin or medicines like glipizide or glyburide, cutting meals too hard or adding a lot of exercise without guidance can make your blood sugar drop too low. And if you have kidney disease, heart failure, or are on fluid limits, do not force large amounts of water without asking your doctor what is safe for you. And please remember this, a foot sore that is red, hot, swollen, dark, or draining is not a watch and wait problem. A sudden change in vision is not a maybe tomorrow problem. A numb foot is not something to ignore because it doesn't hurt. So you're convinced but thinking, how do I actually do this? Start simple. First, pick one sign from this video that sounds most like you, just one. Then track it for the next 3 days. Bathroom trips, thirst, vision, energy, foot tingling, wounds, gum bleeding. You cannot manage what you never notice. Second, clean up breakfast. That one change alone helps many people. Aim for protein plus fiber in the morning, 2 eggs and oatmeal, Greek yogurt and berries, cottage cheese and half an apple. Cheap does not mean bad. Even 1/2 cup of beans with eggs can work on a tight budget. Third, walk for 10 minutes after one meal each day. Not all 3, just one to start. That makes this doable. Fourth, ask your doctor for the basics if you have not had them recently. Fasting glucose, A1C, blood pressure, foot exam, and eye exam. Simple tests, big value. Look, there's a lot of noise out there, a lot of miracle claims, a lot of people trying to sell you powders, teas, or quick fixes. You don't need to overthink this. Your body is already giving you information. Start with just one action today. Drink water instead of sweet drinks. Check your feet tonight. Build one better breakfast tomorrow. Book the blood test you've been putting off. Small steps matter because they turn warning signs into wake-up calls instead of emergencies. And your body will tell you if it's working. You may wake up less at night. Your vision may stop going in and out. Your energy may feel steadier. A cut may heal faster. That is how progress often begins. Quietly. If this helped you, hit that like button. And if you want more videos like this, make sure you're subscribed because we post new health tips every single day. Stay healthy. Stay strong.